WAH45. Once again, we are going to talk about Ebola. But this time, it's going to be different because we've got the opportunity to interview the prestigious doctor and researcher Liliana Niembro. She traveled direct to West Africa to learn more about this illness and the people that are in contact with it. But before I present to you this interview, let me tell you a little background about this topic. Ebola started in Guinea in 2013, then it spread to Liberia and Sierra Leone. 20 cases occurred in Senegal, several in Mali, and United States and Spain have led to secondary infections of medical workers. Ebola is the most widespread disease, and as we know, it has caused plenty of deaths with case of fatality of 70%. Although Ebola was first discovered in 1976 near the Ebola River in what now is the Democratic Republic of the Congo, we started knowing about this disease on December 2013, when the first case was exposed. But this can make you think, why? Ebola can appear due to some factors, such as the extreme poverty, a dysfunctional care system, a mistrust of government officials after years of armed conflict, local burial customs that include washing off the body after death. But this leads us to formulate even more questions, and we, WAH45, have the answers. Our reporter Melisita Ayala had the opportunity to interview the prestigious doctor and researcher. So let's see the interview. But first, we need to know more about the experience of Dr. Liliana in West Africa. And who's better to tell us than herself? Let's hear her out.
Hi, my name is Liliana Niembro and I'm a researcher and a doctor. I came to West Africa to investigate more about Ebola and how disease affect the people that live here. As we all know, Africa is a really poor country, so I'm also here to help with other health issues. Today, I'm reunited myself with Melisita Ayala to give you more advices about Ebola. I hope you enjoy it.
Hi, today the Dr. Liliana is our special guest. Welcome to our program 45 Doctor.
Hi, thank you so much for having me.
So right, now the hot topic is medicine and of course Ebola, am I right?
Yes, we've had such an amazing quantity of work at hospitals.
So doctor, tell us more about Ebola. What are the risks about it?
Well, the main and major risk when you expose yourself to the virus is to get infected, but also there are other risks such as generating a pandemic because you are transporting the virus, and of course, death.
Right, and if we ever get infected, is there any cure to it?
No, currently we don't have a vaccine or treatment for Ebola, and patients with this disease are just isolated in intensive care.
Right, and how is it diagnosed?
It's really difficult to know if a patient is infected or not with Ebola because the symptoms are really confused and with other disease.
What are the symptoms?
The symptoms are fever, headache, and muscle pain.
All right, but doctor, if we ever get a pandemic Ebola, how could we control it?
Not to be drastic, but talking about pandemics, it is a very serious thing. And since we don't have a vaccine or anything to control Ebola, the worst fatality that could occur is that all people get infected and possibly die.
Wow, this is a pretty serious situation.
Yes, it is.
Well, now we know much more about Ebola. Dr. Liliana, let me thank you in name of WAH45 for our time and for this interview. It was a pleasure.
Oh, thank you so much for having me. The pleasure was all mine.
Thank you, Melissa. Such a good interview. Well, that's all for today. Thank you for watching us. We'll see you next week. And remember, we are here. Good night.